Good morning again, everybody. This is our second part of our video series today of interviews. So make sure you get on, write some comments down. We'd love to hear from you. If you have questions for our next interviewee, please go ahead and put those in the comments and I will relay those messages as well. I am very pleased to announce that we'll be opening up our new office here on the east side of town. We were hoping for this Monday, but our equipment is stuck in Houston, Texas. As you can imagine, they're going through some real problems at this point. So our equipment's probably going to get here Monday, Tuesday, or Wednesday next week, and we're looking at a March 1st open. So let's get right to how you can sign up for our contests. You can go to the posts on our Facebook page and look up the website and download your information. It's quick. It would take less than 30 seconds. You can also like, share, or comment. Like, share, and comment on these videos, and we'll put you in the drawings as well. Our guest for the next 30 minutes or so is Dr. Christine Bhinder. She is a podiatrist at Indiana Podiatry, which is here local in town, and they have multiple offices. And we're going to bring her into the picture here, so let me get her in. And so we're equal. There we are. Hi, Christine. How are you?
I'm good. How are you, Jason?
I am super. Thanks so much for joining us this morning.
Oh, thank you for having me.
Christine jumped in like this week, which was awesome, and I'm so glad to have her here. So let's get right to it. Tell us a little bit about yourself, your family, and how you kind of ended up in Richmond.
Sure. So I'm actually originally from Utah, so clear out west. And I got the opportunity to go to podiatry school in Chicago, spent about 4 years there, and then headed my way to Indianapolis. I actually was lucky enough to get my #1 choice in residency at the St. Vincent Hospital in Indy. And that's where I completed about 3 years of my training. And I was trained by some of the highly skilled podiatrists. And after graduating, I was grateful enough for them to help me. They hired me, and the ones who trained me actually hired me. So I was super grateful. And on top of that, I was lucky enough to have one of my offices in the Richmond area. So I love it here.
Really super lucky about that. As I was telling you earlier, we've already had some really great comments about your care and that you're personable with people. And so that's just, you should get that feedback live. So
thank you.
Let's go back for a second. You're
Sure.
finishing you're in your junior year of undergrad, which was where?
It was at Utah State.
At Utah State.
Mm-hmm.
And I'm sorry, I don't know what the nickname of Utah State is.
The Aggies.
The Aggies. Okay, I know Utes because that's Utah, right?
Yep.
Okay.
University of Utah.
Your junior year of school, and you're like, I'm going to podiatry school. Like, how did that happen? What made you want to do that?
Yeah, great question. So I actually went on a dental humanitarian trip out in Ecuador. And that's where we had a bunch of other doctors, different specialties, and podiatry was one of them. And I was just blown away by the diversity that podiatry had. I mean, we were seeing people with skin conditions. One day we had diabetics, we're limb salvage. I mean, we were seeing everything. And so that's when I came back and I ended up shadowing my local podiatrist and found the way to get into school and everything. And I love it since then.
That's awesome. You know, that's like the definition of the proximity principle. It's like get close to something. Wow, I love it. It's my passion, and I go to. So for the people who don't know, tell them what your training is. So you got an undergrad degree in what?
I did biology with a biochem major and a public health minor.
Okay, which is very, 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 very similar to a lot of people who go to podiatry, medical school, PT school, you name it. So then you went to podiatry school in Chicago. Tell people how long that takes to get through podiatry school.
So podiatry school is about 4 years. And the school that I went to was Rosalind Franklin. So it's a combination of both MDs and podiatry mixed together. So we're taking similar classes.
Okay. And then, so you finish podiatry school, and then you have to come out and do a surgical residency, do you not?
Absolutely. And that is required to be 3 years.
3 years. And you did all those in Indianapolis, which was great. And that's how you kind of ended up local here. So awesome. Tell people who don't know what you do. I know what you do because we work with you guys all the time, but like the people who say, what do you do? How do you take care of people? What are the types of people that you take care of on a regular basis?
So, like I said, we see a wide variety of pathology. So, we've got, I would say, a lot of diabetic patients, which are very important to come see a podiatrist to take care of your feet. But we also see a whole bunch of other things. I see skin pathology from like fungus to heel pain one day. And then the next, I'm treating ankle injuries. And then I've got a wide variety of surgeries that people come in for. So, and I see all different ages, not just, we see young, old, and middle age and everything in between. So we're open to anything.
Sure. Why is it so important for diabetics specifically to come see a podiatrist?
So the number one thing that we see with diabetics is definitely they've got the high blood sugars. That high blood sugars usually lead to numbness and tingling in the feet. And the lack of sensation and also the lack of blood flow can lead to injuries. Usually very common, they'll develop like calluses that usually break up and open sores. Stepping on foreign bodies are very, very common, going barefoot. And we're able to test for that. We're able to test for the neuropathy. We're able to test for the blood flow. We're able to get you diabetic shoes. I tell everybody we're always, checking our blood sugar, checking our blood pressure. We forget about the feet, kind of like the last thing, and we only have 2 feet, so we should definitely take care of them, diabetic or not.
So if someone is diabetic and not having any, let's say all their blood stuff is under control, the blood pressure is good, they're not having any type of what we would call neuropathy symptoms, and for those folks, that's a numbness and tingling or loss of sensation. Do they need to seek that kind of help as a check, and how often does it need to happen?
Absolutely. So if you're in that kind of that tier where everything is well controlled, you should still see us at least every year to get kind of a checkup. It's kind of like a yearly checkup that we do for a physical.
Okay. Is there, in regards to the feet, is there some type of good prevention, like tips that you can give to folks like that to say, hey, watch these things on an everyday basis?
Sure. Like we mentioned before, if your feet feel the numbness and tingling, that's the first sign of neuropathy, or your hands also. The other thing would be if they feel cold. That tells you if there's lack of blood flow. Common things to look out for: calluses. Calluses are great places for high pressure. That's why they develop, and those pressure points can actually break down. So that's when you need to come in. If you notice any kind of yellowing, discoloration of your nails, thinning of your skin, lack of hair growth on the feet, those are all signs of something that you should watch out for.
Gotcha. Hey, we already have a question from our audience, so I'm gonna roll that in. Do you see it there on your screen?
I do.
So just to read it, my dad is a diabetic. How do you get them to realize what to eat and not to help them out when their sugar is high?
So what I really believe in nutritionists and approaching them just to they usually have diabetic classes in the hospital. At least we did at St. Vincent. I believe Reed does too. And just getting to that point where you need to form a structured lifestyle where you eat right, exercise. I know it seems to be the hardest thing to do, but it's the most important thing to do, especially when you're trying to get those sugars controlled or maintained.
Yeah, and that's where we kind of come in a little bit, where we get into the exercise with folks, because we see people with this all the time. So it does happen all the time. So great question from Teresa. Here's my next question to you, and I've been seeing this as a clinician, that there are some new medications that folks are going on for diabetic issues, and they're seeming to have a significant loss of appetite, and hence that's bringing down their weight. I mean, I saw someone I couldn't believe. I mean, they had lost like 40 pounds, and I didn't know if the medication was meant to do that, or is that a side effect of some of those meds, or what's your take on some of that?
So it actually varies from person to person. So I've seen some people who it'll work the opposite way, but most will notice a weight loss, which, I mean, it's a plus. I think it helps. It gets you that jump start. It inspires you to go forward and start working out with, like you said, doing the exercise and start with your mobility. So I think it's a great thing.
Good. So let's move into what a podiatrist does from a surgical standpoint. Tell us a little bit about what type of surgical interventions you can do and be kept local and things like that.
Sure. So we treat anything below the knee. So, the typical ankle fractures, ankle or ligament injuries, Achilles rupture, and then you work your way to like the foot. We see a lot of flat feet, very common. Flat feet versus high arch. There's not as many, but a lot of flat feet. And then you work your way towards the toes. So we see quite a few bunions, hammer toes, and those are all structure related to the bone. Some soft tissue stuff, we see something called neuromas. That's an inflammation of the nerve, very common. So it's, again, wide variety.
I wish you were here. About a year ago, I did a 2-part series on plantar fasciitis, and we talked about all the interventions from a physical therapy standpoint. We talked about shoe wear with Esmond Shoes downtown, and that goes along into that. Are you making custom orthotics as well?
We are. We have, we go through a company called Forward Motion, and we've got this 3D scanner. So you don't need to have a mold of your foot. It's very easy. All you do is just hold still and we've 3D scanned that foot.
Awesome. So Annelise says, I'm a flat footer here. Well, I'm a flat footer too. So if there's something that us flat footers should do, number one, and number two, what kind of things do you see that relate to the people who are very flat-footed? What type of problems do you associate with flat foot?
Sure, great question. So my number one thing that I would recommend if somebody who's flat foot or with any foot issues in general is supportive shoes. I think we forget about what is considered a supportive shoe. So my top 3 recommendations are usually New Balance, anything 900 above in their series. Brooks are really good. And then there's a shoe called Hoka, which is one of my favorite ones that I wear every day. So those would say they have support in it. And you can test any shoe. If a shoe can twist and, like I say, a dish rag, it's not a supportive shoe. So
I tell that to my women all the time.
Yep.
Just because you picked it off the shelf because it looks cute is not the right shoe most of the time.
Absolutely.
And, but those are some great points. I also talk, and maybe you can highlight on this when I talk about, like, I love Brooks. Brooks fit my feet really great. But I encourage people to try multiple different types of shoes because what you might like New Balance, but I like Brooks, and I don't like the way Asics fit my feet. So is that something that you highlight as well to your patients?
Absolutely, because I started with my own foot. I started with New Balance, moved to Asics, and I finally found my shoe that fits and works for me, which is the Hoka.
Yeah, and not a lot of people know about Hoka shoes.
No.
The first time I heard about it, I'm like, is that a dance? Is that something going on? But then I got a chance to go down and go to Esmond's and kind of try those on. Now they didn't work great for my feet just because of my foot style, but it felt like I was walking on a cloud.
Absolutely. That's what they feel.
What I need Hoka to do is to make shoes that are steel toes for all of our, because our folks who stand on concrete all day long, and it just kills their feet and their knees. And these Hokas are just so comfortable. And I just, maybe you can put a plug in for them.
I will try.
All right. Let's move on. Tell us a little bit about Indiana Podiatry, where you're located, how you contact people, go from there.
Okay, so the best way to contact, I guess, online, we just type Indiana Podiatry Group, Richmond. It'll be the first one that pops up. We do have a local number. So our number, did you want me to give that to you, Jason, right now? And then we can.
That's totally up to you.
Okay, so it's 888-431-8789. And you can also, we're on Facebook, we're on social media, so you can find us multiple ways.
Awesome. And how often are you here in Richmond?
So in Richmond, I'm here on Tuesdays and Fridays.
Tuesdays and Fridays.
Yep.
And you do surgeries on Thursday, right? You told me that earlier.
Mm-hmm.
Okay. And so, and people can come see you directly. They don't need a family doctor referral or anything like that, correct?
Nope. Just give us a call and we'll get you in.
Gotcha. Great. And so let's talk about the role of physical therapy and podiatry and how they work together. And so maybe you could just touch base on what type of things you see and are best treated conservatively and how you go about that.
So I always believe in conservative treatment as the first option. I will try everything. And physical therapy is one of my favorite modalities. So it doesn't matter if you had surgery or not, no surgery or doing conservative treatment. I always approach physical therapy. For heel pain, for Achilles tendonitis, I mean, working even for strength, balance, plantar fasciitis. I just feel like if you have a place, especially Jason with Cutting Edge, they're already specialized in the lower extremities. So I think they do an amazing job.
Thanks. That's awesome. We see a lot of those folks who come in, and a lot of people, when you talk about some of those diagnoses, are treated very conservatively, and they do great. I mean, if they didn't do great, I kind of joke about how if they don't do great, you'd have surgery 5 days a week, right? Because we couldn't fix everybody. And I think people tend to forget about what some of the conservative treatments are.
I agree.
Awesome. Little nice. My son is being treated there. Very nice. So that's a nice little comment for you. All right. What other things do we need to talk about? What are some things that you'd like people to know that say, hey, this is really important for us to know, or maybe there's something on the, I don't want to say the cutting edge, that would be very cliche, but what's on the cutting edge of podiatry right now that is important for folks to know?
I think the biggest thing out there is just knowing what podiatrists do. I think it gets forgotten sometimes. You know, we see so many other specialists out there, and feet are usually the ones that get forgotten. So I just tell everybody, take care of your feet, because we see a lot of pathology that can go wrong. Sure. It's such a small area, but it's just full of pathology.
Gotcha. Tell us, what's your impression of our area here and the people, and what has been your reception? And
so the Richmond area is just a nice little town. The people are amazing. Everybody's super helpful. Not only is my staff amazing, because they've been there probably the longest, and they treat everybody like family. And I think that's the best part.
That's cool. Yeah, and that's the truth. I mean, the consistency that has been from the staff standpoint at Indiana Podiatry has been great. I know that when I call, I know I can talk to Tracy every time.
Yep.
And I know there's a couple of other staff members that I do talk to all the time, and they're just very helpful. They tend to go out of their way for people and work just like that whole family thing.
I agree.
Let's see if we have any other questions here. There were some other questions. People talk a lot about Morton's neuroma. I've got the neuroma, and what's the best way? Let's talk about what that is, and then how we treat it.
So whenever we hear the word neuroma, or anything that ends in oma, we're just fearful that it means cancer, but it's not. To put it in simple terms, it's an inflammation of the nerve in your foot. And it's usually commonly caused by when we've got two bones called the metatarsal in the foot, and they're usually rubbing together really close. So they irritate that nerve and it becomes inflamed. So, but the best part of it is it's 90% treatable conservatively. The best way we treat it, we've got some neuroma pads that we can put in your shoe. And then usually the go-to treatment is a steroid injection. And that just helps calm it down.
I'm sorry, I didn't mean to interrupt you. What does tell people what the neuroma pad actually is designed to do?
Right. So the neuroma pad will go right below the ball of the foot, and that just helps separate all what we call the metatarsals, or the long bones in your foot.
Okay. And I've heard that despite injection really helping, it does not feel too great, does it?
I do use cold spray, so I think that helps. to alleviate some of the pain. But yeah, injections are not fun.
Awesome. Yeah, most people, especially in the foot, it seems like, people are like, oh, my shoulder, it wasn't a big deal. But boy, when she put that needle in my foot, that hurt. So let's also talk about another thing that I see on a routine basis is posterior calcaneal spurs. And for those folks, that's a spur that's coming off the back of your heel, not on the underneath of your heel, but the back of the heel. And that starts pushing against the Achilles tendon.
Yeah. So another very common one that we see, and it all originates from a tight Achilles tendon. So if you've ever been to our office, our number one thing is stretching, stretching, stretching. It is huge. So, and especially with physical therapy too, I'm sure you'll agree with it. Stretching that Achilles tendon. And it's one of the things that you can do to prevent it. The spur is not the cause of the issue. It just happens over time. It's just tugging and pulling of that tight Achilles. So if you can stretch it, it'll definitely help also with the plantar fasciitis too.
Yeah, we talk a lot about sometimes some heel lifts are very helpful there as well.
Yep.
And then there's the techniques manual wise that we do in the clinic. And I try to tell people that, you start with like a filet mignon, but as you rub that thing and that thing gets rubbed and rubbed and rubbed and rubbed, it goes from a filet to a round steak.
Absolutely.
And people hear that all the time in the clinic. And I said, that's when it starts to become inflamed and irritated and kind of change and things like that.
Yep.
I have a question here for you from the audience. Okay. Let's see. SusAnne says, I have peripheral neuropathy. What's the difference?
So with the peripheral neuropathy, it's affecting, you could essentially say, all over the body. Okay. It likes to start with the extremities first. So your hands and feet are usually commonly infected. I like to tell everybody, if you are diabetic, usually what happens is the sugars are high, and they usually get into the bloodstream, and the blood vessels are also needed for the nerves. And so the nerves start to just go haywire. That's like my best way to explain it. And you end up with that tingling, burning sensation.
And one of the things that we try to rule out, and I'm sure you've seen patients as well, is this neuropathy versus radiculopathy.
Absolutely.
From the spine. So one of the things that we talk about with our patients is to ensure, hey, I'm not diabetic. I don't have foot sensation issues. I can feel everything, but I've got this burning pain in my foot or my lower leg. And I think one of the things that we do as clinicians, one of the most important things we do is ensure that that's not coming from the spine versus coming from the foot. So can you comment on maybe how many people walk in and you go, hey, this isn't peripheral neuropathy. This might be sciatica or some type of lumbar or low back problem?
It's actually more common than you think. So usually my number one question would be like, have you had a back injury? Have you had any spinal fusions? Do you see a back specialist? Common things that we see is if I do a test called the Tennelle sign. I tap the inside of the ankle, and if they notice any kind of radiation of that numbness, tingling, shooting up their leg versus down, that's a good indication that they've got something going on in the back.
Gotcha. And then that's going to be a referral to us probably, right?
Absolutely. Yep.
That's what we're always talking about, right? So, okay, so we're about 24 minutes in. I want to leave a couple of minutes here just to say, what are some of the takeaways that our people should have today, and when should they come and see you, and things like that, just so we refresh that again, because I think that's important.
Sure. Honestly, like Jason mentioned, you don't need a referral. You can just stop by, give us a call, contact us. You don't have to be diabetic to come see us. Just if you've got foot pain or you've got something that's bothering you, or, in general, you just want to come say hi, stopping by.
That's awesome. And where are you located in Richmond, so people know?
Sure. So we are on our address is right 1106 South Richmond Road. So it's very conveniently located, put it that way.
It's basically 11th and 40, right?
Exactly.
That's what I was saying. But if you go to see them, make sure that you go past their building and turn left right after
Right.
the building because the parking is all behind. It's really
It's all
convenient to
behind.
get in and out of there and things
Absolutely.
like that. SusAnne said, thank you for your information, which was awesome.
You're welcome,
Hey,
SusAnne.
on last note here,
Sure.
tell us a little bit about your family. Tell us a little bit about what's going on in your personal life so people get to know you just a little bit better.
Oh, perfect. So I've got a husband and a cute little toy poodle. And so that's a handful for me already.
Who has not been seen in the video yet.
Not yet. Not
Okay.
yet. He got kicked out.
Oh, very good.
He did
Very
get
good.
kicked out.
And what do you, so outside of professional time,
Sure.
what do you like to do?
So I do just, love cooking, reading, chilling, just relaxing whenever I can. But some of the other activities, I do love skiing. Don't get to do as often here as I would like to, but
You mean the slopes are not like they are in Utah, huh?
Unfortunately not.
Yeah, I understand that.
Yeah.
So best book you've read in the last year?
Oh man, best book I've read in the last year. That's a tough, that you can't ask that to a reader because all of them are good.
So you a fiction reader? I mean, do you like that kind of genre?
I do. And I love like the self-help motivating. There's one called The Atomic Habit, and that would probably be the last one I read. So it's a good book.
Habit, very good.
Yeah.
All right. Hey, this is my daughter's question.
Okay.
So could a shooting sharp nerve pain in the lateral calf when running be stemming from my back and not my foot?
Possibly.
Yeah, that's a tricky question.
It is. There is the nerve called the sural nerve, and it's usually, especially when you're running, that could be irritated too. So it could be the sural nerve, which we have different modalities to help you with that.
Gotcha.
Yep.
Best way for her to figure that out?
Come see us.
Okay. Well, she's in Terre Haute, so that might be a little bit of a challenge right now.
No.
But and again, I can vouch for her because I know she's running in good shoes.
Okay.
And those kind of things. So I know she's in the right shoe. But of course, I'm the father, so I'm the last person to know about whether or not someone actually has an issue with their foot. So, but Jolie, talk to me later. Or shoot Dr. Bhinder an email or a Facebook question and to describe that, because if it's happening all the time, is it just happening with certain types of runs? Oftentimes, if you're running on uneven pavement, you can have an issue with that. So we have to talk about that as well.
Absolutely. And then there's also the peroneal tendons too. So got to watch for those.
Apparently, Alex, her boyfriend, is watching as well and says, I got you, Joel. Okay. Because last time I checked, Alex has got the medical degree as well. So,
nice.
And Jolie says thanks. So, all right. Hey, it is, I told you we'd keep it to about 30 minutes. We're running right at 28 minutes. I am so grateful for your time today. And it's been great to get to know you. We just met, so I mean, it's really great to know you. We're glad that you're here in Richmond, and we hope that you find it to be a great place. As I said, I've lived here almost 11 years. The people are as good as they show you when they come into the office. So again, appreciate you coming out. I hope that we can have a stop by at our East Side clinic when we can get that up and running, and we don't have to worry about pandemic issues and things like that. And have you just by, this is a little personal, but have you gotten your vaccination?
Getting there. So I'm next, I think.
You're next, line, great.
So, yeah.
So I'm vaccinated twice.
Nice.
And it seems as though the people in my age category are having some of the symptoms. Yep. So with that having been said, I mean, I had some headaches afterwards. Just took Tylenol and Advil, was fine. But I had two colleagues who were very sick for 24 hours. So just as a reminder that it seems like it's affecting maybe our generation a little bit more. Now I know you're younger than I am, so
which is totally normal. It's totally normal. That means it's working, right?
Yeah, I guess. I mean, I hope so. So we can get out of this mess. So,
yep.
Dr. Christine Bhinder, it has been fantastic to talk to you this morning, and we really appreciate your time.
Thank you so much, Jason. I appreciate it too.
Yeah, you're welcome. We'll see you soon.
Take care. Bye-bye.
Bye-bye. So again, just to remind you, we're having Every hour on the hour, there's going to be an interview. Next up at 10 o'clock is Nick Patel. I did that interview yesterday. I will do a replay of that at 9 o'clock. If you like, share, and comment, you're entered into the contest, but check out the landing page on one of our posts on our Facebook page. Look forward to seeing you the next hour around, and hope you guys have a great day.